In this video, I'll walk you through a small but powerful feature of the Snapshot platform called AI Insights. AI Insights makes it possible to retrieve and converse with information stored in a snapshot right from the context of any application screen. If you'd like a deeper dive into what a snapshot is or how one is created, reach out to us. We'd be happy to dig into the details for you. But for now, let's see AI Insights in action with a real-world healthcare example. Meet Growing Fast Healthcare, a regional provider that's rapidly expanding through dozens of acquisitions. This month alone, they acquired 2 practices, a primary care group running Charm Health as its electronic medical record system, and a urology practice running eClinicalWorks. Their IT challenge? How to get all that patient information into Growing Fast Healthcare's system of record, Epic, when Epic doesn't provide import connectors for those EMRs. Their IT team lacks deep expertise in the acquired EMRs. Custom integrations would be slow, expensive, and disruptive to the business, and everything must be done within 90 days of closing without interrupting operations and patient care. That's a pretty tall order. Fortunately, Growing Fast Healthcare uses M&A Snapshot from Sunset Point Software. Instead of migrating all that data into Epic, we capture both EMR systems information using RPA, or robotic process automation, which serves as a universal adapter that crawls the legacy EMRs to collect screenshots, structured data, documents, and reports. Each patient's information is then packaged into a snapshot PDF file and stored in the organization's enterprise content management system. Epic then links directly to these documents at the point of need via our AI Insights button. No migrations to Epic is required. Let's see how that works. Here we're in Epic, looking at a patient record for Navin Johnson. Navin's new care will be tracked in Epic, of course, but his history spans both the primary care and urology practices because he was a patient of both. To surface that history, an AI Insights button has been added to Epic without modifying Epic in any way. When I click the button, AI Insights instantly understands the context. In other words, it knows who I am as the user to determine access control. What patient am I viewing, Navin Johnson? And which screen am I on, so AI Insights can pare back the scope based on what I'm most likely to ask from this screen. This context drives smarter and faster answers. Looking at the UI, we initially see 2 helpful lists of questions, or AI prompts. The first are pinned questions, which are questions I've explicitly chosen to save for my most frequent workflows initiated from this screen. The second are FAQs, which are questions surfaced by AI Insights based on my colleagues' frequently asked questions from this screen. So if I click the question, which providers has the patient seen, an immediate answer from the snapshot documents is provided, showing me all the providers Navin has seen in the other practices over the years, right here, seemingly from within Epic, without the need to dig through the underlying snapshot files. But what if I want more detail or want to ask more complex questions? I can click the Get More Insights button. This opens a document viewer where Navin's snapshot files are loaded, one from eClinicalWorks and one from Charm Health. Here, I can scroll through and see all his historical encounters, treatments, medications, labs, billing, and more. Even better, I can ask questions directly via an AI prompt window that is opened up below. How about I ask, what was Navin's last PSA level? Now, PSA tests could have been ordered by either the primary care provider or the urologist. The point is, it doesn't matter to me who ordered the last test, and I don't want to hunt for that information. I just want to know what the most recent result was. And here it is. Remember, snapshots are not about providing documents for me to search through, but rather delivering quick and accurate answers to my questions backed by those documents. I can go further. How about asking, show me a PSA history and chart it on a graph? Instantly, I see the trend. If at any time I want to see the details of any of the results, I click on the citation link next to the reading, which in turn brings me to the page in the snapshot for which the reading was ascertained. So there you have it. Growing Fast Healthcare successfully integrated two newly acquired practices in record time without performing a full-blown data migration using M&A Snapshot and AI Insights. And this approach will work for every future acquisition regardless of the underlying EMR, using the same methodology and tool set. To learn more, visit our website or give us a call. We'd love to hear from you. Thanks for your time.